OPD management during Covid-19 pandemic. This is something that we now do every day. We need to ensure few certain important points so that we protect ourselves, our staff, and of course our patients as well from this deadly virus. Every individual entering the clinic should be screened by the thermal gun and the Arogya Setu app. This should be followed by sanitization of hands by an alcohol-based hand rub. The self-declaration form is very important from the medical legal point of view. It should be taken from every patient on every consult, including on every follow-up. Appointments should be scheduled in such a way that crowding is avoided. Also, areas in the waiting and the cabin should be marked in such a way that safe distance is ensured between two individuals. Cap, face shield, N95 mask, gloves and scrubs form the basic protective equipment against the virus. High contact surfaces should be cleaned by at least 70% alcohol and the floor should be sanitized by 1% sodium hypochlorite solution. This should be done after every OPD session. The area should be fumigated once or twice a week depending upon the OPD turnover. Ultraviolet C light is an optional, moderately expensive inclusion, but according to me, a worthwhile investment in addition to the chemical cleaning. Rapid disinfection is achieved in only 10 minutes. However, care needs to be taken to avoid direct exposure.